What's going on, guys? It's Nathan Humphrey, and today we'll be talking about brain tumors. This is going to be like a start of like a new series I'm going to try to do where I'm going to be talking about like different types of cancers. So I know a lot of people, including myself, have people that either have had it or it comes and goes. So this one is going to be brain tumors. What is a brain tumor? A brain tumor is a growth of cells in the brain or near it. Brain tumors can happen in the brain tissue. Brain tumors also can happen near the brain tissue. Nearby locations include nerves, the pituitary gland, the pineal gland, and the membranes that cover the surface of the brain. Brain tumors can begin in the brain, are called primary brain tumors. Sometimes cancer spreads to the brain from other parts of the body. These tumors are secondary brain tumors, also called metastatic brain tumor. Many different types of primary brain tumors exist. These are called non-cancerous brain tumors or benign brain tumors. Non-cancerous brain tumors may grow over time and press on the brain tissues. Other brain tumors are brain cancers, also called malignant brain tumors. Brain cancer may grow quickly. The cancer cells can invade and damage the brain tissue. Brain tumors range in size from very small to very large. Some brain tumors are found when they are very small because of the symptoms they cause that you notice right away. Other brain tumors grow very large and they can be found some parts of the brain are less active than others. If a brain tumor starts in a part of the brain that's less active, it may not cause symptoms right away. The brain tumor size can become quite large before the tumor is detected. Brain tumor treatment options depend on the type of brain tumor you have, as well as its location and the size of it. Common treatments include surgery and radiation therapy. What are the different types? There are many types of brain tumors. The type of brain tumor is based on the kind of cells that make up the tumor. Special lab tests on the tumor cell can give information about the cells. Your healthcare team uses this information to figure out the type of the brain tumor. Some types of brain tumors usually aren't cancerous. These are called non-cancerous brain tumors, like I said. Some types of brain tumors are cancerous. These types are called malignant brain tumors, like I just said. Some brain tumor types can be benign or malignant. Benign brain tumors tend to be slowly growing tumors, and malignant brain tumors tend to be fast growing brain tumors. Gliomas and related brain tumors. Gliomas are growths of cells that look like glial cells. The glial cells surround and support nervous cells in the brain tissue. Type of gliomas and related brain tumors include astrocytoma, glioblastoma, oligodendroglium, and epidemona. I'll put these on the screen, I'm sorry. Gliomas can be benign, but most are malignant. Glioblastoma is the most common type of malignant brain tumors. Chloroplexus tumors start in cells that make the fluid that surrounds the brain and the spinal cord. This fluid is called cerebrospinal fluid. Cryoplexus tumors are located in the fluid-filled cavities in the brain called the ventricles. Choroids plexum tumors can be benign and malignant. Choroid plexicarcinoma is the malignant form of this type of brain tumor. It's more common in children. Embryonal tumors begins in cells that are left over from fetal development. The cells called embryonal cells stay in the brain after birth and are malignant brain tumors that happen most often in babies and young children. The most common type of this is medulloblastoma. Is usually located in the lower part of the brain called the cerebellum. Germ cell tumors start in the reproductive cells called germ cells that go on to become the sperm and egg cells. Germ cells are mostly in the ovaries and testicles, but sometimes they're in other parts of the body, including the brain. When germ cell tumors happen in the brain, they often locate near the pineal gland or the pituitary gland. Germ cell tumors are mostly benign. They're most common in children. Pineal tumors start in around the brain's pineal gland. The pineal gland is located in the center of the brain. It makes a hormone called melatonin that helps with sleep. Pineal tumors can be benign or malignant. Pineoblastoma is a malignant type of pineal tumors that most common in children. Meningiomas are brain tumors that start in the membranes around the brain and the spinal cord. They're usually benign, but sometimes they can be malignant. The most common type of benign brain tumors. Nerve tumors are growths that happen in and around the nerves. The most common type that happens in the head is acoustic neuroma, also called schwannoma. This benign tumor is located on the main nerves that connect the inner ear to the brain. Pituitary tumor, brain tumors that can begin in around the pituitary gland. This small gland is located near the base of the brain. Most tumors that happen in and around the pituitary glands are benign. Pituitary tumors happen in the pituitary gland itself. Craniopharyngioma is a type of brain tumor that happens near the pituitary gland. Other brain tumors. Many other types of rare tumors can happen in and around the brain. Tumors can start in the muscles, blood vessels connecting tissues around the brain. Tumors can form in the bones of the skull. Malignant brain tumors can start from the germ-fighting immune system cells in the brain. This type of brain cell is called primary central nervous system lymphoma. Some of the symptoms that you might have, the signs and symptoms of the brain tumor depend on the brain tumor size and location. Symptoms also might depend on how fast the brain tumor is growing, which is also called the tumor grade. General signs and symptoms caused by brain tumor may include headaches or pressure in the head that is worsening in the morning, headaches that happen more often and seem more severe, headaches that are sometimes described as tension headaches or migraines, nausea or vomiting, eye problems such as blurred vision, seeing doubles, or losing sight on the sides of your visions, losing feeling or movement in an arm or leg, trouble with balance, speech problems, feeling very tired, confusion in everyday matters, memory problems, having trouble following simple commands, personality or behavior changes, seizures, especially if there is no history of seizures, hearing problems, dizziness or a sense that the world is spinning. This is also called vertigo. Feeling very hungry and gaining weight. Brain tumors that aren't cancerous tend to cause symptoms that develop slowly. Non-cancerous brain tumors also are called benign brain tumors. They might cause subtle symptoms that you don't notice at first. The symptoms might get worse over months or years. Cancerous brain tumors cause symptoms that get worse quickly. Cancerous brain tumors also are called brain cancers or malignant brain tumors, like I said recently. They cause symptoms that come on suddenly. They get worse in a matter of days or weeks. Brain tumor headaches. Headaches are the most common symptom of brain tumors. Headaches happen in about half of people with brain tumors. Headaches can happen if a growing brain tumor presses on healthy cells around it, or a brain tumor can cause swelling in the brain that increases pressure in the head and leads to headaches. Headache pains caused by brain tumors is often worse when you wake up in the morning. but it can happen at any time of the day. Some people have headaches that wake them up from sleep. Brain tumor headaches tend to cause pain that worsen when cough or straining. People with brain tumors most often report that the headaches feel like a tension headache. Some people say the headache feels like a migraine. Brain tumors in the back of the head might cause a headache with neck pain. If the brain tumor happens in the front of the head, the headache might feel like eye pain or sinus pain. Brain tumor symptoms by location. The main part of the brain is called the cerebromus. Maybe. Brain tumors in different types of the cerebromus might cause different symptoms. I'm not a doctor by any means. I just like to spread awareness of different like illnesses and stuff. I'm not a doctor. If you guys think that I'm not. Brain tumors in the front of the brain. The frontal lobes are in the front of the brain. They control thinking and movement. Frontal lobe brain tumors might cause balance problems and trouble walking. They might be personality changes such as forgetfulness and lack of interest in usual activities. Sometimes family members notice that the person with the brain tumor seems different. Brain tumors in the middle of the brain. The parietal lobes are in the upper middle part of the brain. They help process information about touch, taste, smell, vision, and hearing. Parietal lobe brain tumors can cause problems related to the senses. Examples include vision problems and hearing problems. Brain tumors in the back of the brain. The occupational lobes are in the back of the brain. They control vision. Occupational lobe brain tumors can cause vision loss. Brain tumors in the lower part of the brain. The temporal lobes are on the side of the brain. They process memories and senses. Temporal lobe brain tumors can cause memory problems. They might cause someone to see, taste, or smell something that isn't there. Sometimes the taste or smell is unpleasant or unusual. When to see a doctor? Make an appointment with your healthcare provider if you have persistent signs and symptoms that worry you. Causes: brain tumors that begin in the brain. Brain tumors that grow as a growth of cells in the brain are called primary brain tumors. They might start right in the brain or in the tissues nearby. Nearby tissues might include the membranes that cover the brain, called meninges. Brain tumors also can happen in the nerves, the pituitary gland, and the pineal gland. Brain tumors happen when cells in or near the brain get changed in their DNA. A cell's DNA hold the instructions that tell the cells what to do. The change tells the cells to grow quickly and continue living when healthy cells would die as part of their natural life cycle. This makes a lot of extra cells in the brain. The cells can form a growth called a tumor. It's not clear what causes the DNA changes that lead to a brain tumor. Many people with brain tumors, the cause is never known. Sometimes parents pass DNA changes to their children. The changes can increase the risk of having a brain tumor. These hereditary brain tumors are rare. If you have a family history of brain tumors, talk about it with your healthcare provider. You might consider meeting with a healthcare provider trained in genetics to understand whether your family history increases your risk of having brain tumors. When brain tumors happen in children, they're likely to be primarily brain tumors. In adults, brain tumors are more likely to be cancer than starting somewhere else and spreading to the brain. Cancer that spreads to the brain. Secondary brain tumors happen when cancer starts somewhere else and spreads to the brain. When cancer spreads, it's called metastatic cancer. A cancer can spread to the brain, but common types include breast cancer, colon cancer, kidney cancer, lung cancer, and melanoma. It's not clear why some cancers spread to the brain and others are more likely to spread to other parts. Secondary brain tumors most often happen in people who have a history of cancer. Rarely, a brain tumor may be the first site of cancer that begins somewhere else in the body. In adults, secondary brain tumors are far more common than our primary brain tumors. Some risk factors in most people with primary brain tumors. The cause isn't clear, but doctors have identified some of the factors that may raise the risk. The risk factors: age. Brain tumors can happen at any age, but they happen more often in older adults. Some brain tumors mostly affect adults. Some brain tumors happen more often in children. Race. Anyone can get a brain tumor, but some types of brain tumors are most common in people of certain races. For example, gliomas are more common in white people. Meningiomas are most common in black people. Exposure to radiation. People who have been exposed to a strong type of radiation have an increased risk of brain tumors. This strong radiation is called ionizing radiation. The radiation is strong enough to cause DNA change in the body's cells. The DNA changes can lead to tumors and cancers. Examples of ionizing radiation include radiation therapy used to treat cancer and radiation exposure caused by atomic bombs. Lower level radiation from everyday objects isn't linked to brain tumors. Low levels of radiation include the energy that comes from photons and radio waves. There is no convincing evidence that using cell phones cause brain tumors, but more studies are happening to make sure. Inherited syndrome that increases the risk of brain tumors. Some DNA change that increases the risk of brain tumors run in families. Examples include the DNA change that caused neurofibromatosis 1 and 2, tuberous sclerosis, Lynch syndrome, Leishmania syndrome, von Hippel-Lindau disease, familial adenomatosis polyposis, Candén syndrome, or Galen syndrome. I will put all those words on the screen. I'm sorry. Damn, that's a lot of big words. Okay. Prevention. There's no way to prevent these. If you get a brain tumor, you didn't do anything to cause it. People with an increased risk of brain tumors might consider screening tests. Screening isn't brain tumor prevention, but screening might help find a brain tumor when it's small, and treatment is more likely to be successful. If you have a family history of brain tumors or inherited syndromes that include the risk of brain tumors, talk about it with your healthcare provider. Like I said, you might consider meeting with a genetic counselor or other healthcare provider trained in genetics. This person can help you understand your risk and ways to manage it. For example, you might consider brain tumor screening tests. Testing might include an image test or a neurological exam to test your vision, hearing, balance, coordination, and reflexes. Alright guys, I hope you guys enjoyed that. There's a lot of big words in there. I'm sorry. I butchered probably all of them, but I'll put them on screen like I always do. I hope this has helped you guys in any way, get more knowledge on it. And like I said, I will be starting to talk about like other cancers and all that jazz in the coming months, and I'm not sure how long it's gonna take, but I want to go over all of them or most of them so you guys can be like aware of everything. I do these videos to keep you guys aware. I'm not a doctor. I just like to spread awareness of different like diseases or cancers or syndromes or anything like that. So if this has helped you or you know anyone with this, please share it. Get the message out. I love you guys. Stay safe. I will see you in the next video.